Assalamu alaikum. This is episode 2 of case based knowledge sharing. And today we are going to discuss a case of Cushing syndrome, or you can say iatrogenic Cushing syndrome. I would like to share a case, a real practical case. A 40-year-old male presented in emergency with epigastric pain. कोई शाम का 8 बजे का टाइम था। एक पेशेंट मेडिकल इमरजेंसी में एब्डोमिनल पेन जो कि एपिगैस्ट्रिक इन ओरिजिन थी प्रेजेंट किया। इमरजेंसी ड्यूटी पर मैं मौजूद था, तो जैसे हम आमतौर पे पेशेंट्स को असेस करने के बाद पेन रिलीव के लिए नॉन स्टेरॉयडल एंटी इन्फ्लेमेटरी ड्रग्स और साथ में स्मूथ मसल रिलैक्सेंट जो इंजेक्शन है जिसमें नोस्पा और इसके साथ गैस्ट्राइटिस को ज़हन में रखते हुए एपिगैस्ट्रिक पेन के लिए हम राइजिक यानी पीपीआई एडवाइस कर देते हैं। और आल्सो हिस्ट्री को ज़हन में रखते हुए 40 इयर्स की एज में जो मोस्ट कॉमन डिफरेंशियल डायग्नोसिस किसी भी एपिगैस्ट्रिक पेन का सोचा जाना चाहिए वो मायोकार्डियल इन्फार्क्शन है। तो इसी तरह हमने पेशेंट की हिस्ट्री को ज़हन में रखते हुए पेन रिलीव करने के लिए और उसके साथ साथ कुछ जो इम्पोर्टेंट बेसिक मैनेजमेंट के स्टेप्स थे वो कंप्लीट किए। और आफ्टर सम टाइम व्हेन आई स्टार्टेड एग्जामिनिंग द पेशेंट I found something other than a normal that was not expected. तो मैंने पेशेंट से फिर फर्दर हिस्ट्री लेना शुरू की, तो कुछ चीज़ें फिर मुझे फर्दर मिली। तो here I want to highlight an important aspect that often books repeatedly say that your history is never complete until you examine the patient. So examining the patient is always very important. So usually everyone, especially in subcontinent or you can say third world countries, mostly rely on mainly on history and examination, because the countries with poor resources are not having every investigation available, especially radiological investigation and advanced blood investigation. So after examining the patient, I came to know that the patient was actually having purple stria on abdomen. And then I became curious that what can be the reason for having these purple strias. So the color was purple. So it was not only because of obesity, because one of the cause of stria is obesity. And then I started asking that what is your profession and how you are living, so what you do for living as well. The patient said that I cannot walk. I basically suffered from multiple fractures. So what actually was the reason for fractures, I will explain in the later segment of this video. Then history kept unfolding as I continued asking the questions. And then when I asked the same question as I shared with you in the previous video, that when was the last time when you were totally normal, then the patient started saying that he was totally normal almost 5 to 6 years back, when he was suffering from some shortness of breath issues, for which he consulted the nearby doctors, for which they gave him some medications जो कि वक्ती तौर पर काम करती थी और उससे मरीज़ की कुछ हालत बेहतर हो जाती थी और मरीज़ इसी तरह अपनी रोज़मर्रा ज़िंदगी गुजारता रहता था। तो दिस एपिसोड्स these episodes kept on coming again and again. तो इसी तरह वो बार बार फिर नज़दीकी किसी डॉक्टर से अपनी मेडिकेशन ले लेता था। जब मैंने मेडिसिन का पूछा तो अक्सर वो नहीं बता पाते कि वो मेडिसिन है क्या थी, बट यूजुअली वो डेक्सामेथासोन या फिर स्टीरॉइड्स जिन्हें कहा जाता है वो होते हैं। तो नाउ I can make a point that this patient, which presented in emergency with epigastric pain, was basically having many of the features of Cushing syndrome. as the most likely reason for developing this Cushing syndrome was repeated injections of steroids for respiratory issue for which he was going to a nearby doctor again and again. So having osteoporotic bone fractures due to repeated steroid injections, developing abdominal striations, purple in color, and then also truncal obesity and buffalo hump, and develop the diabetes as well. So these are all the bookish features of iatrogenic or simple Cushing syndrome. And the patient basically this time was having severe gastritis, and we admitted the patient and planned the endoscopy on the next day, and we came to find that this patient was basically having severe gastritis, and also there was a possibility of pancreatitis as well, but the amylase lipase were normal. So what we learned from this case is basically never take a simple abdominal pain or epigastric pain as simple, because there may be some underlying cause that is being ignored by many of doctors, or the way patient present in emergency, as our emergencies are always hectic and we are always planning to discharge as many patients as we can and as quickly and as early as possible as we can. But develop a habit that try to examine every patient and try to talk with every patient by yourself. And if you can, please always go on the side of the bed of every patient. Then you will develop a feeling that this patient is having the pain due to some serious underlying reason, or just the pain is a normal pain that we humans often suffer because of acute gastroenteritis or simple GI infections. So iatrogenic Cushing syndrome is common. How it presents depends upon the duration and severity of the Cushing syndrome, and also sometimes it's the gender that decides how the patient will present with endocrine diseases. This is the important point, that endocrine diseases presentation is sometimes gender based. I don't want to say that gender based presentation is going to be very different in different genders, but females present usually earlier than males. And this was not a straightforward case, but those who have keen interest in medicine specialty, they will not take this case as very complicated, as it was very obvious that these findings were explainable secondary to iatrogenic due to steroid intake. So I hope this case-based knowledge sharing is going to help you people, and the retrospective digging and asking the patient different questions in the past can help us know the history of the disease, or you can the way a disease behaves is sometimes helpful when we are not able to make a right diagnosis, or sometimes we are in between the diagnosis and our tests are coming equivocal and our labs are not supporting our theoretical history based diagnosis. Then the nature of the disease is sometimes helpful, as if someone is thinking of some malignancy and the problem is going on, or the symptoms are there from 10 years, then it is very less likely that patient's symptoms are due to malignancy. So message, I would like to quickly summarize today's session, that what we have learned in this video. First, it was that uh, never conclude the session with or interaction with the patient without examine. So history is never complete until you examine the patient. Second, Cushing syndrome, most common cause is iatrogenic Cushing syndrome, and this is because of maltreatment by quacks. Then what we discussed is we can learn a lot from the patients by just giving attention to them and listening carefully to them. Okay जी, अल्लाह हाफिज़। In the next video, I will share another case by which we can learn some medicine, as this medicine is a very beautiful subject, but those who are keenly interested in this subject. Allah Hafiz. And I would like to request that please like, subscribe, and share this video with all of your colleagues as well.